In this video, we're going to talk about psoriasis. So what is psoriasis? Psoriasis is an integumentary disorder that affects the amount of keratin that is in the skin. And so what it happens is it develops too much keratin. What is keratin? Keratin is the defensive part of the skin. It's the also is found in hair, so it's a very strong protective portion of the skin. And when it is overproduced, it ends up resulting in very scaly skin and very hard, rough skin. So what causes psoriasis? Well, it is found to be an autoimmune disorder, and as many autoimmune disorders are found, it has remissions and exacerbations. So what are some risk factors for developing exacerbations for psoriasis? So patients that have been diagnosed with psoriasis may have exacerbations when they're under stress. And this is because stress affects the body as a whole, and when you affect the body as a whole with stress, it affects your immune system, and that makes most autoimmune systems disorders have exacerbations. So stress, and this stress can be due to infections, any infection in the body. It could be due to cold weather. It could be due to changes in hormones. It could be due to trauma. Anything that causes stress can cause an exacerbation. So during these exacerbations, what do we see? Well, typical psoriasis, you got scaly skin. I say it's scaly because it's a lot of keratin, so a lot of the hard protective layers. Also, you'll see silvery patches. And these silvery patches, when the patient scratches up and down on them, you can see sometimes they'll bleed, or when you scratch yourself, your skin kind of turns that white silvery color. It's because maybe they're scratching on them. What happens with the exacerbations is they'll start developing skin lesions. They'll have little papules in the scaly skin patches that will come up, and when you're scratching them, these papules they can bleed. They'll crust over. They can happen on the palms and on the palms of the hand. They can happen on the bottom of the feet, anywhere on the body, and then the body gets very inflamed and very red. So the main two you will see is scaly skin with silvery patches, and in exacerbations they're going to have increased redness, and they're going to start having skin lesions. I recommend you look on Google Images, type in psoriasis, and you'll see these silver patches. So what is treatment for psoriasis? Well, autoimmune disorders are typically treated in pretty similar ways with topical steroids, because steroids reduce the immune system. So if you decrease the body's immune system, and then what happens is it's not able to attack itself. Specific to psoriasis, though, you can see tar, literally tar, smeared on the patient's skin, and then they use ultraviolet light in conjunction with the tar, and what it can do is it can put the patient back in remission, and maybe they'll not have psoriasis for a good couple of years. So tar treatment with psoriasis. Also, I told you, so they can have tar applied to the skin, they can have steroids applied to the skin. Another one here is they can have epidermopoiesis suppressors. Well, what the heck is that? Epidermo, okay, something with the skin. Poiesis, okay, the skin, poiesis has to do with reproduction, so the growth of new skin. Suppressors, so these medicines suppress the body from growing new skin. When they get these medicines, though, and the reason they give these is because this will keep it from growing more and more keratin. Well, with these, you want to make sure they wear sunscreen when they're outside, because when you go out and you get a sunburn, your skin has to regrow itself. And you want to avoid if pregnant, because these medicines suppress the growth of new cells. Well, you don't want to have to give birth to a baby that has no skin. Now, here's another one, cytotoxic medications. Now, these are given PO, so they're going to swallow these. This is going to have a systemic effect on the entire patient. And what these do is cell, toxic to the cells. These reduce the regrowth of any new cells in the entire body. And so this is going to stop new skin cells from developing. But you got to watch out for some side effects. If you're pregnant, you don't want this, because it's going to cause your baby to be born with deformities because they're not able to grow all the cells they need. And also, you want to watch out for pancytopenia. Okay, so we got penia is a low level, cyto of cells, pan, this has to do with a group of them. So if you're taking a medicine such as this, it can cause decreased white blood cell count, it can cause decreased red blood cell count, and it can cause decreased platelets. So what this does is it'll leave the patient being anemic, at risk for infection, and at risk for bleeds. Now, this is psoriasis, which is scaly skin with silvery patches.